maintain proper weight?
It's just not knowing what to do. And if you're taught what to do, people typically in my program lose on average anywhere from 25 pounds up to, Karen is my biggest female loser. She was 65 pounds, I believe, and another gentleman was 68 pounds. So anywhere in between, but typically 25 pounds on up after our 3-month program you can expect. And some people that are 400 pounds will just continue to keep losing weight. We have very few that don't reach their goal. If you're a patient of mine and you come in and you want to lose weight, I absolutely have a goal to help you with your goal. But my goal is beyond that. What are you going to weigh in 5 years from now?
Right.
What are you going to weigh in 20 years from now? No other program talks about that, but it's about your health.
Right. You need to change how you eat.
Absolutely.
You need to change your lifestyle. You're not, if you want to keep the weight off for the rest of your life.
That's right. That's right. And you will live longer.
Because so many people are thinking short term. I got to look good for this wedding, or I got to look for this reunion. No, you got to look. You got to look good for the rest of your life. You want to be healthy for your children.
Absolutely.
Yeah. Well, stay tuned. In our next segment, we will be discussing weight loss and your personal metabolic age. Now is the time to call Dr. Willen to register for his free local seminar. I'm with Dr. Steve Willen. Now, you routinely do metabolic age testing with Diet Triad. Can you tell me about that?
There's 2 types of ages, Erica. There's our chronological age and our metabolic age. The chronological age is obviously how long we've been on this earth. This machine is able to tell us obviously what our chronological, but it also tells us actually how long we've been here in terms of use. Most of the patients that I see are obese or overweight. For example, Ron is a 62-year-old man who was significantly overweight. When we tested him, he showed a 78-year-old metabolic age. And he asked me, he says, what does this mean? Well, there's 2 different kinds of fat. There's fat under our chin and fat under our arms. It's called subcutaneous fat. It won't kill us. But there's fat around our heart, abdominal aorta, our lungs, our liver, and so forth. That's called visceral fat. And visceral fat causes us to age prematurely. Why? Because the heart is having to beat that much harder and that much faster to get blood through stuff that shouldn't be there.
Right.
Well, Ron is 62. He checked out as a 78-year-old man. Now, after going through our program, his metabolic age is 44 years old. He's got his whole life down.
That's significant.
Absolutely.
12 weeks this week.
Okay. And when you started out, you were a little heavier than you are now. How much weight have you lost?
Right at 50 pounds.
Right at 50 pounds. This is close to being one of our biggest losers of all time.
Yes, sir.
And you just told me you've lost how much body percent?
It's dropped from 27 to 17% body.
Amazing.
Body fat.
And then you also, your metabolic age is younger than your chronological age. So
I'm actually 64 years of age. My medical body age, I guess you would say, was 66, and it's now 49.
Wow. So you went from 66, you've dropped 17 years?
Yes.
By losing weight.
By losing weight.
Yeah.
I feel absolutely phenomenal. Before I went on your weight loss program, I had gained so much weight that I was feeling lethargic. I would get winded very easily. Even tying my shoestrings in the morning, I'd get a little bit winded. I've gone from a 40 waistline, 40 size pants, to 34.
Wow.
And I'm still losing weight. I want to lose a little bit more.
Absolutely.
But my energy level is off the chart. I feel absolutely phenomenal.
But you can be really old metabolically, and that's the number that we die by. It's not our chronological age. If your heart is wearing out, like most people that are overweight and obese are, then people that are overweight die 20% younger than people who are not.
Because the heart just can't possibly move that body around.
Absolutely. And the fountain of youth is not something out of a genie in a bottle. It comes right here. Get rid of our fat and we live longer.
Now, I know a lot of your patients are saying that their medical doctors are absolutely thrilled with them. You want to talk about that?
Well, I mean, I've had medical doctors come through my program. When patients finally, for one time, they get their diabetes under control, they get their cholesterol, they get everything working like they've been trying to tell them for years, I mean, they're pleased.
My medical doctor strongly encouraged me to lose weight because I was borderline diabetic. My mother was diabetic, my grandparents were diabetic, and I've got several relatives on my father's side that were diabetic, so I was borderline. And I put it off, and finally, one day I happened to be watching Channel 2 television, and there was a little excerpt on the morning news about your practice and about the free seminar, and I decided to come. And it's just been a life-changing set of circumstances for me.
Now, you often say that this is more than just weight loss. What do you mean by that?
Well, the seriousness of weight loss, to me, and the seriousness of being obese is just so important. We have what we eat and what we drink determines how long we live or how short we die. So if you want to live longer, then eat better and drink better. If you're drinking diet sodas and you have high fructose corn syrup, that stuff is more addictive than alcohol to our brain. And the more high fructose corn syrup and sodas we have, the fatter we're going to get. I mean, 8 teaspoons of sugar in every soda that we have. Diet sodas, tons of aspartame. There's nothing but salt and carbonated water in sodas, and it's got a bunch of sugar on it, and there's nothing nutritious in those. These sports drinks that these kids are drinking are addictive to their brains, and they're going to wind up not living a healthy life or as long a life. So the longer you eat good things, the longer your life will be.
I've got more energy than I ever had in my life. I feel great all the time. I get up at 5 o'clock. I feel great when the clock goes off. And I'm going down the road in the mornings. I'm eating my apple and drinking my water. I have a break at 11 o'clock, and I'm good to go.
Why are you so passionate about people and helping people lose weight for life?
Well, as I said, I've been there. I've lived being obese. I'm not skinny, and I may never be, but I'm not him anymore. And I know I'm just 3 or 4 buffets away from being him again. And so I know other people are the same way. So there needs to be help for this. And there's so many diets. Every day you can open up magazines, TVs, radios. 95% of them fail. And so this time, if you're going to lose weight, learn how to keep it off so you never have to do this again. And that's what I'm passionate about.
This is my 12th week. I've been on the 12-week program. I've been in here every week having my, different things that you go through, the exercises, going into the sauna, getting the body wraps, the foot detox, and I've enjoyed every week of it.
Great.
Look forward to coming.
Great.
I've lost 30 pounds.
Awesome.
My blood pressure has gone down from like 134 over 94 to 107 over, I think it was 70 today.
Yeah, that was your best ever.
Yeah, that's gone down. That's in the range it used to be when I was slimmer.
Okay.
So, I mean, that was more normal for me. My toxins have gone way down. I'm in the green now. My adrenal gland has gotten much better. I'm in the green. The thyroid has improved, down in the green with that as well. And my energy level's gone way up. I mean, I don't want to nap in the afternoons anymore. I stay up till 10 o'clock without being sleepy watching TV or whatever I'm doing at night. Initially, I thought it was going to be very hard. I mean, I was kind of dreading it. I've been on other diets before, and you kind of yo-yo up and down. But with this program, I followed it pretty closely. I didn't do everything exactly as the book said, but I stayed within the range of what we could eat.
Yes, ma'am.
And every week I lost weight. Every week there was incentive to, continue, and it wasn't hard to stay on the program.
Can people lose weight just from attending your seminar?
Sure. I mean, I give tips about all these things I've talked about. Whether you do my program or not, you'll come away more educated and you'll be able to make better informed decisions.
That's great. Well, that has been some powerful information today from Dr. Steve Willen of the Diet Triad. Now, if you or anyone you know is tired of being overweight and battling the roller coaster dieting fight and want to solve it once and for all, then go to the phone and the website below to register for Dr. Willen's free seminar. You'll be glad you did it. You can easily and instantly avoid the hassles and pitfalls of weight loss directly from the man that has helped hundreds right here in the Triad area. Decide this second that you are going to lose the weight for life and call Dr. Willen. I'm Erica Schaefer, and it has been my pleasure to be your host today on Special Segments. Thank you.